Tuberculosis, or TB, is a serious illness caused by Mycobacterium tuberculosis. TB primarily attacks the lungs but can affect other parts of the body. Understanding TB is the first step to fighting it. TB can be latent or active, with active TB being contagious. Education and public health efforts are crucial in controlling TB. By learning about TB, you can protect yourself and others. TB bacteria travel through the air, which is the main way the infection spreads. When a person with active TB in their lungs coughs, sneezes, or even speaks, tiny bacteria are expelled in water droplets. These droplets are so small you cannot see them and can stay suspended in the air for several hours. This makes enclosed, poorly ventilated spaces risky. Imagine someone with active lung TB in a room. If they cough, the TB bacteria enter the air. If another person breathes in that air, they can get infected. The risk depends on several factors, including the number of bacteria in the air, the duration of exposure, and the ventilation of the room. People with weakened immune systems are more susceptible to infection. Close and prolonged contact increases the risk of TB transmission, which is why TB can sometimes spread among family members or people living in crowded conditions. Casual contact, like shaking hands, does not spread TB. Sharing food or drinks also does not spread the bacteria. TB is not spread by touching surfaces like doorknobs. It is specifically about breathing in the bacteria from the air. Knowing this helps focus prevention efforts correctly. Once inhaled, the bacteria can settle in the lungs and begin to multiply. The body's immune system will try to fight them off. Sometimes, the immune system controls the bacteria, leading to latent TB. Other times, especially if the immune system is weak, active TB develops, highlighting why stopping airborne spread is vital. Practicing good hygiene is a fundamental step in TB prevention. Always cover your mouth and nose when you cough or sneeze. Use a tissue, then throw the tissue in a bin. If you don't have a tissue, cough or sneeze into your upper sleeve. Do not cough or sneeze into your hands. Wash your hands often with soap and water. Use alcohol-based hand sanitizer if soap and water are not available. Avoiding close contact with people who have active TB is important. If someone you know has active TB, they need medical care and should follow their doctor's advice to prevent spreading it. Proper ventilation in indoor spaces is a key defense. Open windows and doors regularly to let fresh air circulate. Use fans to improve air movement if possible. Good ventilation makes it harder for TB to spread. Wearing masks can provide an additional layer of protection. If you have a cough or respiratory symptoms, wear a mask. In areas where TB is common, masks might be recommended, especially in crowded or healthcare settings. Masks act as a barrier, reducing droplet spread. Section 4. Early clues and defenses. Diagnosis and vaccination. Recognizing the symptoms of tuberculosis is crucial for early diagnosis. A persistent cough lasting 3 weeks or more is a key sign. This cough might produce sputum, sometimes with blood. Other common symptoms include fever, often in the evenings, unexplained weight loss, and a general feeling of tiredness. Night sweats and chest pain, especially when breathing or coughing, can occur. If you experience these symptoms, see a doctor promptly. Early diagnosis leads to quicker treatment and better outcomes. If your doctor suspects tuberculosis, they will perform tests like a skin test or a blood test. Further tests like a chest X-ray are needed to confirm active lung TB. Vaccination can offer some protection, especially for children. The BCG vaccine is used in many countries and is often given to infants and young children. The BCG vaccine helps protect against severe forms of TB in children, including TB meningitis. However, its effectiveness in preventing lung TB in adults varies. Early diagnosis allows treatment to begin sooner, preventing the disease from becoming more severe and reducing the time a person is contagious. If you have been in close contact with someone with active TB, get tested. Screening high-risk groups is also a public health strategy. These conditions can weaken the immune system. Section 5. Winning the battle: TB treatment and long-term health. The good news is that tuberculosis is a curable disease. With the right medical treatment, most people can fully recover. The main treatment for active TB involves a course of antibiotics. It's not just one antibiotic, but usually a combination of several. This combination helps to kill all the TB bacteria effectively and prevent the bacteria from becoming resistant to drugs. Treatment can be challenging, but it works. Completing the full course of medication is absolutely essential. TB treatment typically lasts for 6 to 9 months, sometimes longer. It is very important to take all your medicines exactly as prescribed. Do not stop taking them, even if you start to feel better. If you stop treatment too early, the bacteria can survive and might become resistant to the antibiotics. Drug-resistant TB is a serious global health threat. To ensure patients complete their treatment, many programs use DOT, or directly observed therapy. This means a healthcare worker or a trained volunteer watches you take your pills. DOT helps ensure the medication is taken correctly and consistently, greatly increasing the chances of a full cure. Your healthcare team is there to support you through treatment. Regular medical checkups and follow-ups are vital to monitor your progress and manage any side effects. Living a healthy lifestyle also supports your recovery and overall well-being.